Hello, this is a description of my experience with 3 surgeries for retina reattachment, and I want to make this quick video explaining what happened so that I can refer to this later in case I need to remember. And if anyone is interested in this topic, if you listen in, it might help you out. You learn a lot through this experience, and it's what happens. My retina started to detach about a year ago, and that was in July of 2016. So I went in. I waited too long, but I went in about a week later, and they brought me right in for urgent surgery to reattach the retina. Now, there's a Minnesota Vikings coach in my area here, Mike Zimmer, who had the same exact thing happen at about the same time. So I was reading newspaper accounts of that, and it said that he's had 4 surgeries to date, and I've had 3, so he actually has had more. But there's so many complications and ways and methods of fixing this that I can easily see how you could have multiple surgeries, because they might want to try this or try that. The surgeries are painless. They're no problem. Hopefully you have decent insurance. I happen to have it, so it's not a cost issue. But basically what happens is the retina starts to tear in the back of your eye, and it's like a curtain coming down. It's exactly like this, like a black curtain, and you lose your vision from one top corner down to the other. It could be a different pattern, but basically it gets worse and worse every day. You should go in the first hour you see that happening. And if you get floaters, you should have that checked too, the dots. So the first surgery was a little harder because I had waited so long, and quite a bit of it was detached. And then they put in a nitrous oxide bubble that's gas, and I had to, for about a week or 5 days, I had to hold my head in this downward position like this 24 hours a day. And sorry about that. And that was the most uncomfortable thing of all, because holding your head down like that, you know, I did rent an apparatus where I could rest my head on a soft pillow type thing, and had a mirror so you could watch TV. And if you're going to have to be in that position for more than 4 days, definitely rent that apparatus. I don't know how you get along without it. It's just too uncomfortable to hold your head down. Any medical supply store has those, and they'll bring them out to your house. They're real easy to set up, and you rent it for a period of time, then they come and pick it up. It's positioning equipment for your head. Everybody has them. They're very common. So then after that, I had actually a lot of pain in the eye as it was healing. I guess they had left a little blood in the eye, which is not unusual, but it did cause a lot of pressure. So I had a lot of pain for a month, and I just plowed through it. And I could have probably got a redo sooner, but I didn't know if that was typical or not. So a month later, 2 months later or so, I had another surgery, and they took out the nitrous oxide and they put in an oil bubble, and I had to sleep on my side so my head wasn't looking up like this at night, because they wanted the oil bubble to float again to the back of your eye, just like the nitrous oxide, so it would help hold up your retina in the back of your eye, hold it in place long enough for it to heal, because they take a laser gun and they shoot laser shots into the back of your eye, and it's like welding the retina to the back of the eye. And this happens every day for the people who do this surgery 10 times a day. It's just old hat, but of course it only happens to 1 out of 10,000 people or 5,000 people or whatever. So when it happens to you, you don't know anything about it, but you can quickly learn just by internet research. The information is out there, and it's very common. What causes it? It just, as your eye wears out, the retina gets tighter like a drum skin, and it's held down. And if your eyeball changes shape, which every eyeball does. As you grow older, it might get oblong or whatever. I think that's why your glasses prescription changes. So it can happen for just that or an unknown reason. I did jump out of an airplane in a parachute a couple weeks before it happened, and the eye doctor said, well, that could have nudged it along. It probably wasn't really the cause, and it didn't happen at the time. It was a couple weeks later. But if you get a real bump or something like that, maybe that could cause it. But I don't know enough about causation to make an intelligent statement here. So I had the second surgery, and after the first surgery, I was virtually blind in this eye because the nitrous oxide and the way it was set up, I don't think I could really see anything, just maybe a little bit of light. It was like having my eyelid shut. Then after the nitrous oxide, I could see shapes. It was like if you had your eye open underwater when you're swimming in the pool. You can kind of see things, but not really very well. So, but that got better from September 28th, 2016 until today. Surgery today was April 20th, 2017. So that's September, October, November, December, January, February, March, April. That's, wow, is that 8 months? No. September, October, November, December, January, February, March, April. 7 months. I didn't realize it was that long. They maybe could have done it sooner. But anyway, when I take this bandage off, or the doctor's going to take this bandage off tomorrow, because tomorrow morning is my post-operation appointment to see the doctor. He'll take this bandage off. I kind of peeked a little bit, but I can't really tell. I can definitely see light, and they said that I might be able to actually see pretty well with it, or I might have to get a new glasses prescription, or maybe try a contact lens, or they might put a plastic lens in, which is very common whenever they do a common surgery in the eye, where they clean the eye out and put in a lens. So I'll know tomorrow a little better, but my sight has been getting a little better over the last 7 months, but not enough to really be of help. It's more of a distraction. I kind of got used to closing my eye because it was easier to just see out of one eye, because this is so blurry that it causes a huge distraction. In fact, the doctor said that some people put Scotch tape on the inside of here of your glasses, if you're wearing glasses, because it blurs everything out and it's almost like closing it. And so I did that for a while, but you do kind of get used to only being able to see well out of one eye. And I was able to do whatever I did before pretty much. It didn't really stop me, except it's kind of an annoyance because you don't notice things real well when you're sitting right in front of you. And driving was fine. I can drive right now, because this eye is 100% 20/20. So this eye is not affected at all. So in a lot of ways, it's not that bad. But I would just say to myself, for down the road, if you have a lot of pain after the surgery or any pain, definitely talk to the doctor about it, because this should be a painless procedure. It's not something that should cause pain. The first one did for me, but that was because I didn't complain about it, and it had some blood and so high pressure in the eye. It was actually the most painful thing I've ever endured in my whole life. And even medication, super strong prescribed medication, didn't even make it dull the pain enough to where it was worth taking the medication. I didn't want to have to deal with any possible side effects with the medication, so I figured I'll just have the maximum amount of pain and figure out how to mentally endure that. Which, wow, you can stand a lot of pain if you have a reason to. I was kind of surprised. I've just never had that much pain before, and you can endure it. It's not that big a deal. It's all mental, and it's all about the fact that if you have a big enough reason, you can endure any amount of pain, right? So I have a lot more empathy for people who say they're in pain. It's like, okay, now I've walked the walk. Even though it was only for a month, I totally understand where you're coming from, and pain is a pretty bad thing. Because I've had a painless life my whole life. I've been fortunate, I guess. Never broke anything or whatever. I guess that's all. Just I'll check in with myself. Maybe I'll listen to this in a couple of years, and it'll just be funny because this thing will all be healed up. It'll be no big deal. But I wanted to say this now because I know I'm going to forget all this stuff after a few weeks. If it's, well, I will forget it because it's not worth remembering. Okay, so see you around. I hope this helps anybody. If you're going through this, you know, it will get better. But as you get older, you really got to get your eye appointments up to date and, you know, physicals and teeth and everything else. If you have the insurance, even if you don't, you should just keep up on that, because even though I feel as well now at my age as I did when I was 29, life does have a way of creeping up on you, and it overcomes you and things wear out. I don't feel like I'm wearing out, but it is inevitable, right? So keep that in mind as you grow older. Bye.